with L and R, and today we are going to discuss about the new topic that is belongs to International Nurses Association, and the name of the topic is the American Nurses Association, or ANA. The importance of belonging to your profession. Nursing association. What do your associations do? Set the standards of practice for the profession. Code of ethics maintained by the association. It promotes the profession in the public and educate their member regarding the issues through continuing education and publications. It also advocate for their members and on the federal and state level, provide opportunities for members to interact, discuss trends and disseminate knowledge. Nursing associations, there are over 100 specialty organizations focus on clinical aspects of each specialty, focus on areas that are unique to the specialty. American Nurses Association focus on the issues that affect all of nursing and patient care. Then the history of ANA, deplorable working conditions and the need to protect the public from incompetent women who claim to be trained nurses propelled nursing leaders to form an association of trained nurses. Before that, the people who are not attained the nursing education but they perform the duty as in nurses. This association prevent the public as well as remove these kind of women who are not educated. In September 1896, the Nurses Association Alumni of the United States and Canada was formed, renamed the American Nurses Association in 1911. The goals of the association: to establish and maintain a code of ethics, to elevate the standards of nursing education, to promote the usefulness and honor the financial and other interests of nursing. Then a sample of historical accomplishment: in the year 1901 helped secure passage of a bill creating the Army Nurse Corps under the direction of a properly trained nurse. In 1913, with the Red Cross, ANA developed a plan that took public health nursing to rural communities. In 1934, ANA's House of Delegates approved an 8-hour work day for nurses. 1945, ANA intensified efforts to recruit nurses for military service as an alternative to President Roosevelt's proposal to draft nurses into military services. 1955, ANA helped pass a bill to commission male nurses in the Reserve Nurse Corps. Then in 65, ANA was the first association of healthcare professionals to endorse the creation of Medicare. In 1976, Nurse Training and Health Services Bill vetoed by President Ford was overridden by Congress, recognizing the existing and expanding role for nurses in delivering healthcare. In 1986, helped to create the National Institute for Nursing Research at NIH. 1998, ANA supported the Patient Right to Know Act with provision for anti-discriminatory language, coverage of emergency care and prohibitions of gag clauses in managed care plans. Then in these days, ANA today, ANA goals in present: professional practice and excellence. ANA successfully champions professional nursing excellence through standards, code of ethics, and professional development such as credentialing and lifelong learning. Second, healthcare and public policy. ANA is an acknowledged leader in the formulation of effective healthcare and public policy as they affect the profession and the public. Then the third one is knowledge and research. ANA is the recognized source for accurate, comprehensive health policy information based on knowledge from research. Unification. ANA facilitates unification and advancement of the profession. Workforce and workplace advocacy. ANA with its partners and through its organizational relationships is the leader in promoting improved work environments and the value of nurses as professionals, essential providers and decision makers in all practice settings. Then foundation work, ANA's foundation work, Code of Ethics for Nurses, a statement of the ethical obligations and duties of every individual who enters the nursing profession. The profession's non-negotiable ethical standard, an expression of nursing's own understanding of it is commitment to society. They can understand their commitment regarding their duties. ANA's foundation work, nursing scope and standards, 23 current standards produced in cooperation with the specialty nurses organizations. Nursing society policy statement reflects a new definition of nursing. ANA working for nurses on Capitol Hill, it is a place at America. Nurse Reinvestment Act provides federal funding for scholarships and training, funded for $150 million in 2006, a 120% increase from 2000 funding levels of $68 million. Smallpox Emergency Personnel Protection Act of 2003 assures the proper administration of vaccinations, compensates individuals injured by the vaccine. ANA protecting nurses, needle stick and sharp injury prevention. ANA successfully pushed for enactment of OSHA Bloodborne Pathogen Standard Needle Stick Safety and Prevention Act of 2000 and multiple state needle stick legislation. Estimates show declining rates of needle stick and sharps injuries. Though injuries continue to occur, our work is not done. Train the Trainer program teaches implementation of a needle stick prevention committee and compliance with OSHA regulations. ANA needle stick prevention guide available free on nursingword.org website. ANA protecting nurses, back injury prevention, safe patient handling. ANA board approves position statement titles elimination of manual patient handling to prevent work-related musculoskeletal disorders in June 2003. Co-sponsorship of annual safe patient handling conferences in coordination with the Tampa VA Patient Safety Center. Educational campaign targeting frontline nurses, healthcare administrators and nursing schools. Ergonomics identified as a priority for ANA nationwide state legislative agenda. Then ANA protecting patients, recognizing the aging population. ANA nurses competence in aging program works to increase nurses capacity to care for aging patients. Covered the uninsured week May 1 to 7 2006. ANA is the only nursing organization among 18 national partners. Take action for healthy blood pressure campaign, free blood pressure screenings and consumer education intensities in partnership with State Nurses Association in 2005. Then ANA promoting nursing coverage for the work of ANA and nursing in prominent magazines, newspapers, radio and television. Nurses have topped Gallup's Professional Honesty and Ethics poll every year but once since 1999 when nurses were first added to the poll. In 2001, firemen were rated number 1. ANA providing the value of nurses. ANA's National Database for Nursing Quality Indicators helps to demonstrate the positive impact of the appropriate mix of nursing staff on patient outcomes, provides data at the unit level, develops a database to inform practice and policy. ANA, along other nursing organizations, has funded research to help quantitate the economic value of nursing. Then ANA representing nursing. ANA representing nursing at numerous tables. Then ANA subsidiaries. The American Nurses Credentialing Centers, many programs including certification for all levels of nursing and Magnets Hospital recognition program. The American Nurses Foundation has awarded over 900 nursing research grants since 1955 with over $3 million granted. The AAN is comprised of 1,500 plus qualified and savvy nurse leaders who are literally at the top of their profession. AAN members have been identified by their peers to be the best and brightest in the nursing discipline. Then ANA organizational members, constituent member associations. ANA has a state nurses association in every state plus the District of Columbia, Guam, the Virgin Islands, and a uniformed nurses constituency. Organizational affiliates. Currently 21 of the top specialty nursing organizations belong to ANA. State Nurses Association key in protecting the nurse practice acts in each state, instrumental in advancing the rights of advanced practice nurses in each state, the voice for nurses at the state legislature. ANA and the State Nurses Associations work to coordinate this effort to be more effective. All this work is already being done. Why do I need to belong with ANA? Belonging is important. Why? More nurses belonging to nursing associations gives additional power to the association when speaking in front of Congress and other regulatory bodies. Gives additional funds for associations to do work on behalf of the profession. Puts nursing in a position to direct healthcare policy versus reacting to it. Then plus membership gives you a voice in the decisions being made for the profession, the opportunity to receive discounts and benefits as a member, discounts on certification, free continuing education, access to members only information, a chance to interact with nurses around the country. How do I belong? A variety of ways to belong when you are in. Through your state nurses association, most states offer discounted dues for new nurses. In some states, directly to ANA or your CMA. As a student, you may become a subscriber to member only on nursingworld.org. Become involved now by participating in your local National Student Nurses Association chapter. Then ANA and nursing are excited to have you join the profession. We hope you will join ANA and your specialty nursing association. For more information, if you would like to know more about the ANA, then you have to visit the site nursingworld.org, the official website of the American Nurses Association. Thank you very much. I hope you have clear with this topic.